Most people don't expect a headache to show up during sex, but an orgasm headache can be surprising and scary. Orgasm headaches are also called primary headaches associated with sexual activity. Even though many cases turn out to be harmless, it is important to understand what's going on and when these headaches could mean something more serious. Orgasm headaches happen during sexual activity, usually right before an orgasm or at the exact time of an orgasm. They come in two major forms. Some people experience a steady, dull ache that builds as sexual excitement increases. Others get a sudden, explosive, thunderclap-like pain at orgasm that reaches maximum intensity within seconds. That second type can feel so severe that many people fear something dangerous is happening, like a brain bleed or stroke. Why do they happen? The exact cause isn't fully understood, but researchers have identified several likely mechanisms. Sexual activity naturally increases heart rate, blood pressure, and muscle tension. These rapid changes may temporarily raise pressure inside the skull or cause blood vessels in the brain to react suddenly. For some people, that sharp change triggers intense pain. There's also evidence that neck and jaw muscle tightening during arousal can contribute, especially in the gradual pre-orgasmic type. When should you worry about an orgasm headache? Even though primary orgasm headaches are usually benign, their symptoms can look like extremely dangerous conditions. A sudden severe headache, especially something you would call the worst headache of your life, can be a sign of a brain bleed, an arterial dissection, a venous sinus thrombosis, or something else very dangerous. Because orgasm headaches can look identical to these medical emergencies, you should seek emergency care after your first severe sudden headache during sexual activity. Doctors typically start with a non-contrast CT scan, ideally within 6 hours of having the headache because it's highly sensitive for detecting bleeding. If the CT is normal but symptoms raise concern, other tests may be recommended like a lumbar puncture, an MRI, or even an MR angiography. If imaging confirms that the headache is not related to a dangerous condition, treating an orgasm headache depends on how often the headaches occur and how disruptive they are. Many cases happen once or twice and resolve on their own without medication. For people who have recurring or severe episodes or orgasm headaches, doctors often recommend taking indomethacin about 30 to 60 minutes before sexual activity. Other medications that your doctor may recommend include triptans and beta blockers. Reducing anxiety also matters. After one intense episode, many people develop fear around sexual activity, which can increase tension and make headaches more likely. Clear reassurance after a proper medical evaluation can make a difference. Orgasm headaches are unusual but real. Luckily, most are harmless after serious causes are excluded, and many resolve without long-term problems. But because they can look identical to medical emergencies, any sudden severe headache should be treated as an emergency the first time it happens.